Namaskar, and thanks once again, Professor Gupta, for this invite today. I come from an agency which is called BIRAC, Biotechnology Industry Research Assistance, which we call it an enabling agency. Major part of our job is funding, but the second part of is to enable the innovation, to literally, de-risk that innovation and hit where the patient population needs or the community needs it. Coming straight to AI, the AI work started within our system. I also had an organization called the Grand Challenges India, which is a joint initiative with the Government of India through Department of Biotechnology and the Bill and Melinda Gates Foundation and the Wellcome Trust. So where the concept of AI started, with the basic line which the earlier presentation also showed, any AI platform needs a strong database. And data was the critical element. We start working with data initially in particular areas of maternal and child health first through a program called Healthy Birth, Growth and Development Initiative, where we looked at data, especially data for which is, bringing down looking at stunting, wasting in, child population, nutritional data, to see how implementation can be used. And this data was used to develop, policy briefs, and Dr. Gupta was a part of these discussions, to discuss, make policy briefs for the policy makers to be implemented. But when COVID came in, things changed, and use of AI and ML was very critical element, which the innovation needs to be transformed in that way. Looking at that, we literally looked at how to support the innovation community in our country, beginning with global expertise. We started with a program firstly on the last mile delivery of vaccines called Idea Challenge, where we looked at how we could track sitting in a room where the vaccine vial with a batch number is delivered to which patient. That was the innovation we started with to support innovation in that level. And we literally funded almost 15 innovation in that space, and 3 got literally shortlisted to a level where they are now being implemented. Recently, artificial intelligence, the machine learning, the large language models, which was just described, was a critical element, and we launched a call for artificial intelligence use of AI in healthcare. And that was an initiative which really attracted big number of innovators in India, starting from the academic innovators to startups. And the idea was to look at clinical decision support tools, population health and policy making support for frontline healthcare workers, health communications, and the patient journey, which was talked about in the earlier panel, and health system strengthening. These are the critical elements we are looking at to have solutions which can literally support our clinical community, and it can disseminate to the last mile in our country. I think lastly, I would like to say that this can't be done by a single innovator. We need teams. We need teams. I think that is what the big challenge is. We need teams. We need software people who literally devise those softwares. We need clinical people who needs to validate it. We need business people, acumen people who did ready to scale it up. I think so our ultimate urge is that to develop AI can't be done by a single group, a single person. It needs a multiple ferrous of teams from the academic community, from the clinical community, from the people who can literally scale it up to a level so that it can be delivered to the last mile. So lastly, it has to be a 360-degree innovation which literally brings all of them into one platform. Thank you once again, Professor Gupta, for this initiative, and thank you very much.
Thank you.